life-changing outcome. I'm going to switch over into arsenic a minute. It's going to seem like I'm backtracking a little bit. It's because I couldn't talk about arsenic and DDT at the same time, so we're going to move back to 1851, move on again. Arsenic was considered potent, effective, and safe, and to generally agree very well with children. Bartrip wrote an article in 1992, and he referenced several medical texts of the time on that. You can read it for yourself. Right about when the polio epidemics were increasing, so was the use of arsenic in household, medical, and agricultural products. Paris green and Shields green were dyes that were used in Paris, in Europe, and the United States. Arsenic was used to treat lung problems. Doctors would prescribe arsenic added to tobacco to be smoked. Arsenic was used to treat cholera on the basis that a greater poison would destroy a lesser poison, and this wasn't in a homeopathic remedy. This was just actual chemical arsenic. Dentists used arsenic acid to kill nerve endings in decayed teeth. Arsenic poisons moved from common household items to medicines that were approved by the AMA. In 1939, the AMA lent its seal of acceptance to a drug called triparsamide, which was an arsenic medicine manufactured by Merck under license from Rockefeller Institute for Medical Research. This drug was used to counter the effect of syphilis, often with 100 injections in a single patient. I couldn't believe this when I read it. So I did a little literature search and I turned up a few papers, and this one I picked to show you. There are several quotes like this throughout this paper. It was a matter-of-fact thing, and they were just talking, this was a case report, said another patient who had previously received 34 injections of arsphenamine, which is another arsenic compound that was much older, 23 injections of bismuth, 76 mercury rubs, had a paretic type of serologic relapse. Can you imagine that? After 104 injections of triparsamide. This is what they called medicine in the 1930s. And we're the quacks. In 1981, a Russian doctor experimented with arsenic in various animals. Clinically, he saw poliomyelitis. At autopsy, he noted identical pathological changes as poliomyelitis. Dr. Papal concluded that arsenic, even a few hours after its ingestion, may cause acute central myelitis or acute poliomyelitis. This is another amazing article, The Poison Cause of Poliomyelitis and Obstructions to Its Investigation. This is a must-read. This was actually used to testify in front of the House of Representatives. They still didn't listen. Cows and other farm animals exhibited identical symptoms to humans in the early 1900s and 1930s, but cows are not susceptible to poliovirus. Some families called what their children had the cow disease. Cows were dipped in, on all kinds of livestock, were dipped in arsenic water in order to get rid of bugs. Sister Elizabeth Kenny was an Australian nurse who started treating infantile paralysis in the outback, and she just did whatever she could do at the time. And she wrote an autobiography, and innocently in her autobiography, she knew nothing about what was causing polio or the poison cause. But she said that a very agitated father of 7 came to me with the appalling announcement that his 10-year-old son and his 4-year-old daughter had been taken with what he called the cow disease, and neither of them could stand or walk. They went lame yesterday, just like the cattle have been doing for the past 2 or 3 weeks, he explained, and today they can't move. But this was called infantile paralysis, and it was all lumped in the same basket as polio. So that's what polio was, and now we're going to talk about where polio went.